Can sleep apnea be cured? Sleep apnea is when your breathing stops and starts while you sleep. If you suffer from this malady, then you have my sympathy. I've suffered from this complaint since childhood and have woken up with the horrible realization that I have stopped breathing. Although nowadays I wake to my body violently sitting up as that movement restarts my breathing. It's a horrible sensation, but fortunately rare. Most of my sleep apnea events last for only seconds and don't wake me violently, although they rob me of deep sleep and leave me exhausted the next day. For those of you who don't suffer from this complaint, these are the sleep apnea symptoms. Remember, they normally happen while you sleep, so it is useful to ask someone else about your breathing at night. The most common symptoms are: your breathing stops and starts while you sleep, causing you to make snorting, gasping, or choking noises. You wake up often during the night, sometimes with violent motions. You snore loudly. During the day you may suffer from some of these side effects. You feel very tired and find it hard to concentrate. You are fatigued and can fall asleep easily during lectures or meetings. You are irritable and can be emotional. You can wake up with a headache. For me it feels like a mild hangover. Your libido is very depressed. If any of these symptoms are bad, I would advise you to see a medical professional to have a proper test. Untreated sleep apnea can kill. This is an unpleasant condition for both the sufferer and anyone who sleeps with them. Can sleep apnea be treated? Fortunately, there are treatments. Some people with mild sleep apnea believe that they are just loud snores and invest in one of the many cures for snoring. These are often devices that are designed to hold the airways open. For some people these are sufficient. One of the most common treatments is a continuous positive airway pressure, CPAP, machine, which provides non-invasive ventilation of pressurized air through a face mask. These machines work well and help to alleviate the main symptoms of sleep apnea. However, there are some major drawbacks to them. They can be uncomfortable to wear, as the mask straps have to be tight to hold the face mask in place, and the hose makes finding a comfortable sleeping position difficult. I find that I need to use more pillows so that I am propped into a half-sitting position. The CPAP machines also make a continuous noise and have an exhaust port in the mask that is a source of an annoying draft. Are there other ways of treating sleep apnea? There are other solutions, such as surgery, but they tend to be expensive, and some are unreliable. I came across a digital product called Snoring and Sleep Apnea No More, that I have, and use, myself. If you want to learn more, click the link below.